All right, I hope everyone can see my slides.
You are good?
Perfect, thank you for confirming. So I just wanted to highlight tomorrow, April 16th, is National Healthcare Decision Day. So healthcare organizations across the US are hosting events or starting the conversation because it's National Healthcare Decision Day. So I just want to say thank you for being here, taking the time to learn, and we welcome questions, like Kayla said, in the chat, and we'll have time at the end to get those questions answered. Advanced care planning is a process that identifies what's most important to a person in terms of goals of care and future healthcare decisions if the person becomes very ill and not able to communicate their wishes. Today, we're going to talk about what advanced care planning is, what the benefits of advanced care planning are, and how to get started with a healthcare directive. And of course, there will be time for questions and discussion at the end of the presentation. This slide is intentionally busy and overwhelming because it can feel overwhelming for people to even begin to think about advanced care planning, maybe even serious illness or end of life planning, and then finally documenting those healthcare preferences and wishes into a legally valid document. So advanced care planning is an umbrella term, and this just kind of shows or depicts all the various elements that can fall in or fall under the advanced care planning umbrella. And this isn't everything, but just to highlight a few, it's really about learning about treatment choices, reflecting on your choices given your goals, values, and beliefs, having conversations with family, loved ones, and care team members about your wishes and treatment preferences, and then documenting those preferences by selecting either a healthcare agent or writing your wishes in a healthcare directive. And again, these are just some of the things, and I do want to acknowledge that this conversation can bring up a lot of feelings and it can be hard, and we just want to acknowledge that. So we're hoping to make this process as easy as possible and give clear next steps and to normalize the conversation. It's important to kind of highlight some key advanced care planning terms, first being advanced directives, which are legal written documents that help guide care decisions if a person cannot talk or make healthcare choices for themselves. In Minnesota, the advanced directive most people choose to fill out is called a healthcare directive. A healthcare directive can name a healthcare agent, share healthcare wishes and preferences, or both. Advanced directives in itself is also an umbrella term. There are several different documents that fall under the umbrella of advanced directives. For today's discussion, we're going to focus on healthcare directives and briefly mention and discuss the POLST, the Provider Order for Life-Sustaining Treatment. So again, healthcare directives include either healthcare instructions naming an agent or both. A healthcare agent is an individual who's been chosen to make healthcare decisions on behalf of a person if the person were to lose their ability to communicate or express their wishes. A healthcare agent can only be named in a legal healthcare directive, and healthcare instructions is defined by an individual's documented wishes, values, and preferences regarding healthcare treatments. We highlighted the sections where each of these you can note in our Health Partners Healthcare Directive, which Anne will be walking through later in this session. So we like to break things down into kind of clear steps. So what is advanced care planning? It involves essentially 3 high-level steps. First, asking and reflecting on what matters to you. And that's kind of a broad question. And so when I try to prompt this question for others, I think, what brings you joy? What's most important to you? What does a good day look like? To kind of help you start thinking about, and I welcome if you have a pen and a paper at home to maybe jot down some ideas as we're talking about what matters most to you. The second step is who speaks for you? Who do you trust to make decisions for you when you're not able to communicate your wishes, and who's going to honor your wishes? So we'll talk more in depth about how to choose a healthcare agent or who's going to speak for you in a few slides. And then the last step is communicating what matters most to you and who speaks for you with those who need to know. So who would need to know that? First, your healthcare agents, if you're naming a healthcare agent. Second would be your healthcare team and your other loved ones and family and any other important people in your lives. I do want to highlight what advanced care planning is not. It is not estate planning. It does not involve decisions about money or assets or finances, and it does not require a lawyer. With that said, there's some elder care attorneys that have packages, and in those packages, they highlight different documents, and one of those documents is a healthcare directive. So some choose to complete their healthcare directive through a lawyer, but it is not required, and you can fill out your healthcare directive on your own. There's several benefits for advanced directives, and first that kind of comes to mind is peace of mind. It can be really reassuring for people if they've filled out their directive, they know and they've communicated that they've completed their directive and their wishes with loved ones and their care team. It can provide some just peace of mind and relief. Advanced directives are not just for end-of-life care. And with that being said, we recommend that any adult 18 and older with capacity to do so should complete, if they're willing, a healthcare directive. And that's because accidents can happen at any point in life. There could be a car accident, a cycling accident, etc. But just know that it's not just for end-of-life care. Advanced directives also simplifies things for your loved ones. It can provide peace of mind for them to know that they're honoring your wishes and your values when they might have to make decisions on your behalf. So it's really kind of a gift, as some say, to your family and loved ones. Other additional benefits of advanced directives is it really clarifies goals and preferences for care. It's really helpful to kind of have someone express their values and priorities and their preferences for certain treatments. It also encourages conversations about difficult but important topics. And the conversations in themselves are invaluable. And so you'll hear that throughout today's conversation. Your advanced directive is protected by state statutes. It also helps your care providers know your wishes, and it also provides peace of mind for healthcare workers who want to follow your wishes or patients' wishes. So since we've broken it down into 3 high-level steps, first is what matters to you. Again, these are just some prompts to think about what are your values and priorities. What should family and clinicians and the care team know about you if you lost the ability to communicate? Things to consider would be medical treatments, end-of-life care, preferences on hospice. Are there spiritual or religious considerations that you would want them to know? Do you have a preference on CPR? And then some other items are care of the body after death, for example, cremation or organ donation. And we'll talk about more of that when we get into the healthcare directive. So again, what matters to you? It can start out very broad with high level values and wishes and priorities, and then kind of start to get more specific through care preferences and decisions for medical treatments or actions. And so on the right hand of the slide, there is some just examples that people have written or that have been shared with us. For example, wanting to avoid pain, that home is where my cat is, that they're not a morning person. So you can be as specific or as broad as you want in these conversations and in your healthcare directive. And healthcare directives are really as unique to each individual, and they can range from a variety of responses. Who speaks for you? This is our second step. Who do you want to speak on your behalf if you lost the ability to communicate your wishes for medical care? In Minnesota, we call this the healthcare agent. Other states have different terms. You might hear healthcare power of attorney. You might hear healthcare proxy. So just know that in Minnesota, we use the term healthcare agent. It should be a trusted person that knows you well and that's going to honor your wishes. One example, and we'll talk briefly about this too, is there is a short form in Minnesota where primarily it names a healthcare agent, and then we will be going over the long form today. In Minnesota, if you don't have a healthcare agent, they're going to look to the family and friends that show up for an individual and look to them to kind of understand what that person may or may have wanted or not wanted. So, and then our last step, communicating with those who need to know. Having the conversations with loved ones and clinicians is very important and should be the first step. 2, completing a healthcare directive with healthcare instructions, naming an agent or both is another way to kind of share your wishes. 3rd, if someone's interested in limiting interventions, for example, they do not want CPR, they should talk with their clinician about filling out a post. And then the last step is really to review and update your healthcare directive when there's a significant change in health status or life circumstances. Some say to review it after the 5 Ds, which is a new diagnosis, decline in health, a death maybe in the family, maybe a healthcare agent has passed, a divorce, and I might have missed the 5th D. If I did, I will circle back. And this just highlights how to make your healthcare directive legal, and we'll go over this again. I do want to highlight there is a variety of forms that you can fill out as a healthcare directive in Minnesota. There's no requirement on a specific type of form. And most health systems, for example, Health Partners, has their own healthcare directive. Mayo, Allina, Fairview, they have their own healthcare directive forms. So I always encourage people to use the form that resonates with them. And to make it legally valid or legally sufficient in Minnesota, it needs to be a written document. The individual has to have decision-making capacity at the time and are filling out the healthcare directive willingly. It should include healthcare instructions, appointing or naming a healthcare agent or both. Includes your name, signature, and signature date. And your signature and date need to be witnessed or notarized. And the 2 witnesses cannot be named agents, and that goes for the notary as well. You should always keep the original copy of your healthcare directive and make copies for your healthcare agents, loved ones, and your primary care or specialty care clinics wherever you receive medical care. Advanced care planning is working when it results in care guided by your values and priorities. I shared a lot of information, so I'm going to pause and invite any questions in the chat, and then I'm going to hand it over to Anne.
Michelle, I think you may have missed decade. Is that the 5th D that you missed?
Yes, Anne, thank you. Decade,
Welcome.
every 10 years, and and some say even every 5. Thank you.
Yes, you're welcome. So this is Ann Sathrum, and I'm going to just go over the Minnesota Healthcare Directive step by step. And if there's any questions, you can either put them in the chat or raise your hand while I'm going through it. I'm happy to answer questions while we're doing it. There are many types of healthcare directives, but this is the one that we'll be going through. So the first section, Section A of the healthcare directive, is where the patient would complete their name, date of birth, address, just basically information to let people know whose form it is. Just complete that. Just want to make sure that you write it clearly. And some people that can do it online and type it in, and that's fine, but it would have to be printed out and have it signed by 2 witnesses or a witness that's a public notary. The second section is assigning the healthcare agents. And so this is the area where people appoint a person to speak on their behalf if they are in a situation where they cannot speak for themselves. The agent does not have to be a family member. It should be a trusted person, could be a friend, other kind of relative, neighbor. Some people I have worked with that did not have anyone that they could put as a healthcare agent for them. And that's okay. There's other sections in here that we would go ahead and complete, even though they didn't have a healthcare agent. This way that the care team, medical staff would know what their wishes are for them in the future, their healthcare wishes. Responsibilities of the healthcare agent will be making decisions regarding medical care, treatments, surgeries, tests, and end-of-life care. This would include when to stop life-sustaining treatment. Other responsibilities include selection of physicians, care team members, or a healthcare facility, if in the future they were to need like a long-term care facility. Review and release of medical records. Decisions regarding disposition of the body at the time of death. And the qualities of an effective healthcare agent is going to be someone willing to assume the responsibility and listen to the patient's preferences and priorities. Someone that's trusted, not easily intimidated, someone that would be a good advocate for the patient's values and goals for care. Keeping in mind that if you have siblings, they might have different ideas of what should be done towards end of life or life-sustaining treatments. The person should be capable of making major medical decisions under stressful conditions, and that healthcare agent must be 18 years of age or older. And as you can see there on the form, you can list more than one person. You could have the primary healthcare agent, and if they are not able to get a hold of that person, it might be nice to have an additional healthcare agent listed available. The next section is section C, and this talks about additional powers of the healthcare agent. And sometimes this is kind of confusing, but so I'll go with them with these one by one. The first one, people would put initials in these boxes if they agree for the healthcare agent to, the first one says, continue as my healthcare agent, even if our marriage or domestic partnership is legally ending or has ended. Oftentimes, somebody that you've been married to or had a partnership with for many, many years, they know you the best. And that's who you trust the most. And so sometimes you, even though you're not with them anymore, you'd still want to have them be your healthcare agent, and that's okay. The second area there says make healthcare decisions when I choose, even though I'm able to speak for myself. And how I describe that to people is, say you're in a car accident, you hit your head, you have a screaming headache, and you just don't feel like making any decisions right now. So you would tell your healthcare agent, please, you make the decisions right now. And so marking that box gives you the ability to do that. The next box is make mental health treatment decisions, including neuroleptic, antipsychotic medications. I think that's important, especially nowadays when we have so much mental health problems out there. Somebody might need something just to help with anxiety, and this will give, you're giving that person permission to agree to allowing the doctors to give you medications for that. And then the last box there does not apply to a lot of people, but it says, if I am pregnant, determine whether to attempt to continue my pregnancy to delivery. I don't have a lot of people that I've dealt with or have assisted with healthcare directives that have been pregnant. So, but that is there. The next section is section D. And this, it talks about hopes and wishes. This gives people more ideas or more understanding of what is important to you as an individual if you're the one completing this form. So the first one says, how do you define a good quality of life for yourself today? What does living well look like to you? Some people say living at home independently. That's important to me. not losing independence, not being in a wheelchair. I mean, things like that. Those things are important to people. Being able to get up every day, getting dressed, bathing, putting food on the table, cooking for people, doing gardening, fishing, boating, things like that. The next one, what would be unacceptable quality of life? For instance, if you couldn't do certain things. So no longer able to drive, no longer able to do your own laundry, being incontinent. Next one is thoughts about receiving or not receiving specific medical treatments, if any. Some people on this one might say, I don't want dialysis, or I never want someone to put a tube in me to feed me. The next one, thoughts and feelings about the care I would want at end of life, whether that be a hospice or never wanting to be in a nursing home, or I've had other people say, I would like to die in a hospital. So a lot of people just think about like past experiences they've had with loved ones, with illness and death when they're completing this section. Some people have like comfort preferences at end of life, or they want warm blankets, or they've got a loved pet that they want to be around them. Family or friends visiting, whether they want music to be sung to them, things like that. And section D it's helpful for the care team and healthcare agents because it provides insight into what's important to the individual that's completing the healthcare directive. Section D. Now this talks about more choices and preferences, but this one's about cardiopulmonary resuscitation and what people's thoughts are on CPR, whether they want to have CPR or not. The first one, it just says, I want CPR attempted when my heart or breathing stops. Second one says, I want CPR attempted when my heart or breathing stops based on my current state of health. If my health changes in the future and I have no reasonable chance of recovery, then my agent, if one appropriate, will discuss attempt CPR with my healthcare team based on earlier conversations or statements I have written in section D, my hopes and wishes. The last one is, I do not want CPR attempted when my heart or breathing stops. I understand if I choose this option, I should see my clinician about completing the provider order for life-sustaining treatment, or the POST form. And at that point, if somebody were to choose that one, that's when I would complete the POST form for them. And we'll talk just briefly on that a little bit later. This next section, section G, there's a part here that I really like to stress. So with section G, sorry, I'm lost. Section E. Sorry, this is about treatments that may prolong my life. With any choice below, I understand that I will continue to receive all pain and comfort medicines and be offered food and liquids by mouth if I'm able to swallow. Now, this is a part that I find really important. If the time comes that I can no longer speak for myself and my healthcare team and agent believe I will not recover my ability to think, communicate, or know who I am, I want. The first one says, all medically reasonable treatments available and agreed upon by my healthcare team. This includes, but is not limited to, tube feedings, IV fluids, a ventilator or breathing machine, and antibiotics. I want treatments to continue until such treatments are harmful or no longer helpful. And again, I like to repeat to people, this is if your healthcare team believes you will not recover the ability to think, communicate, or know who you are. So the next section, or the next box, is if that is it, they would say to stop or not start treatments that may extend my life. This includes, but is not limited to, tube feedings, IV fluids, breathing machines, and antibiotics. There is an area there that people can add additional comments on regarding treatments that may prolong their life, what their if they have anything additional that they want to add there. So anyway, I think that's a very important area there to complete. And another thing, as I talked earlier, if somebody does not have a healthcare agent, I think it's important to complete this section and the previous section, the part about the code status. Just because that lets the care team know, even if you don't have a healthcare agent, what your wishes are. The next section is section F. And this is, it talks about spiritual affiliation. If somebody has that, or maybe they do not identify with a spiritual religious tradition, but it gives them the opportunity to provide that information if that's important to them. The next section is about organ donation. Some people say they want to donate eyes, tissues, and organs if able. My healthcare agent, according to Minnesota law, may start and continue interventions needed to maintain my organs, tissue, and eyes until donation has been completed, or you do not want to donate organs. And then the next section is about your preference for your body after death. You can somebody can either mark here saying that their healthcare agent has the power to make the decisions about the body when they die, or people can put their own preferences in there, saying I want to be cremated, or I have already donated my body to the U. They might say I do not want a funeral service. I want a memorial service. Maybe they want people to get together and eat ice cream, and that's what they want for their memorial service, just a remembrance, so people can document in there what their wishes are. The next part says comments or directions to my healthcare team. Honestly, most people have not written anything in there, but I have had people have write how much they appreciated their doctors and their care team, and they've had me write that in there for them. And then the last page is the signature page. And that's where the person completing the document needs to put their signature in there. I have had patients that cannot, but anyway, cannot sign it. I've had them do, they've written an X in there, and I've initialed it for them because they might not be from here, might be from another country, and they don't know how to write their signature. The next section is the witness. So in order to make the document legal here in the state of Minnesota, it needs to have either 2 witnesses, or it has to have a witness who's a notary public to complete that section. And I've told people that maybe you want to find a couple that you can sign for them and they can sign for you, a man and a woman, a husband and wife or whatever. So you can find 2 different people if you to be as their witnesses there. But I think if you can get a notary public to sign it, that's probably the best. But either one works. Are there any questions about completing the healthcare directive that anybody has? So I briefly talked about the POLST, or it's called the Provider's Orders for Life-Sustaining Treatment. And it's a type of advanced directive, but it's actually a medical order that is signed by a medical doctor, a PA, nurse practitioner. Oftentimes, this is tells the first responders and emergency staff what care a person wants as far as CPR goes and breathing machines. If a pulse is not completed, and if the EMT arrives at somebody's home and finds them not breathing and their heart has stopped, they will attempt CPR So they will provide compressions, they will intubate, they will provide medications, they will do everything that they possibly can to try and bring this person back if the pulse is not completed. So a pulse is recommended when someone has a serious or advanced illness and they want to limit certain emergency treatments. And it can be followed across all care settings, meaning at the doctor's office, in the hospital setting, and then they're at home. So if somebody completes, if we complete the pulse for a person, we make sure that there's a copy in the home and usually instruct the person to put it on the refrigerator, ideally in a red envelope, because that is where EMT is going to look to find out what the wishes are as far as CPR goes. So again, the healthcare directive is an actual legal document that it's just a communication tool that we use between families and clinicians. And they could have instructions or list the healthcare agent. It's completed by an adult, ideally somebody, everyone 18 and over. That's really what I recommend, as long as they have decision-making capacity. It's not a medical order. So if you wrote on your healthcare directive, I do not want CPR, that is not a physician order, and the paramedics would still have to try and attempt to resuscitate a person who does not have a heartbeat or is not breathing. Whereas the pulse is an actual medical document that the first responders and ER personnel would use to determine whether a person wanted CPR or not. It has specific healthcare wishes for specific medical actions. Some people could say they don't want you to attempt resuscitation, but if they're still breathing and they still have a heart rate, they still might want to be intubated. It's completed by an adult with decision-making capacity or a surrogate with help of a healthcare professional. And it is a medical order, can be shared across settings. I think, Michelle, are you next?
I am. Thank you. So
Thanks.
now what? Thank you, Anne. We've shared a lot of information, so we just want to highlight now what. The most important thing to do is to have conversations with loved ones, especially, and your clinician about what you want. Don't expect others to bring it up because they may not. So please, we encourage you to ask questions, bring up the conversation. You could use National Healthcare Decision Day tomorrow as an opportunity. If you have a healthcare directive, make sure your family and clinicians have a copy. Remember, you keep the original, the copies can go to family, healthcare agents, and your health systems. If you don't have a healthcare directive or you want to update the one you have, you can do this at any time. It's a process, not an event, so you can update it as often as you want. You could update it every year, every week even. Most people don't, but you can update it at any point. If you want to change your document, you want to make some big changes, you'd fill out a new one and then follow the process to make it legally valid. And this question comes up a lot too, if people want to know if I just want to change maybe my phone number or my address, you could cross the address or the phone number out and initial and date that change, but then you'd want to provide copies to the health systems and your agents again so they have that updated information. If you were changing big medical changes like wanting CPR to not wanting CPR or other medical treatments or interventions, you would want to fill out a new directive. The most recent dated document is the one that is valid and the one care teams will go with.